All right, so we're going to be looking at the arteries in the rabbit, and we're going to start on here again on the aortic arch. And we actually did a video on this last week, but we're going to just review it real fast. So there's our aortic arch right there. That's the ascending aorta. There's actually the arch right there, and then I'm going to have the descending aorta, which is going to go down into here, and we'll get to that in just a minute. Coming off the aortic arch, the first branch is going to be the brachiocephalic trunk, which is right there. And then my brachiocephalic trunk is going to bifurcate into my right common carotid. The right common carotid here is cut right here, but it would continue up into the neck. And then we have the right subclavian, which is going to go down into the front leg of the rabbit, or in the human, it's going to go to the shoulder and then to the arm. Then we have the left common carotid, which is right here. And then we have the left subclavian, which is right here. So that's the left subclavian, and then like we said, there's the right subclavian. Right subclavian is coming off this brachiocephalic trunk, and the left subclavian is coming off the aortic arch. Then if we look in here, like I said, there's my thoracic or descending aorta. And once it gets past this flimsy thing right here, that's my diaphragm, it's going to become the abdominal aorta. And that's it right there. As it continues down, coming off the abdominal aorta, I'm going to have the celiac trunk right here. Celiac trunk is going to provide blood flow to the stomach, the lower part of the esophagus, the liver, the pancreas, and some other organs. Then coming down, we're going to have our renal artery, which is going to go out to the kidney. So here's the kidney here. That's the renal artery right there. That's the renal artery right there. And then my other renal artery is going to be right here. Then we're going to follow this down, and it's going to come down to here. And my aorta is going to bifurcate. It's going to become the right common iliac artery and the left common iliac artery. Then my common iliac artery is going to bifurcate again into the external iliac artery and the internal iliac artery. And then this is going to go on to become the femoral artery, which I'll make another video on. So again, this is my external iliac. This is my internal iliac. This is my common iliac, the aorta, renal artery, right? Trying to separate that from the renal vein. That's the renal artery, celiac trunk. Then if we come up again, here it's going to be my descendant or thoracic aorta, aortic arch. And again, that's the ascending portion of the aortic arch. The aorta. And then this is the aortic arch, brachiocephalic trunk, right common carotid, right subclavian, left common carotid, and left subclavian. And that's it for the arteries of the rabbit. And like I said, next time we'll go down into the legs, and I'll do some on the arms. Thanks for watching.